Welcome to Sovereign Health of Chandler. We're in Arizona, outside of Phoenix, just a few miles away. This is a women's only program. We only take women ages 18 to 65. We offer residential, partial hospitalization, intensive outpatient programming, and outpatient with transitional living. So our first step is intake. Let me show you how that process begins. Follow me. So we have two clinical coordinators. Our clinical coordinators do our intakes. So this is a process by which a person is entered and admitted into our treatment program. There are forms that need to be signed, consents for releases of information. Financial information is also part of that. We'll come down here. This is the intake room. We have two rooms where we do intakes. And the room, as you can see, is large enough if a family member accompanies the patient in, they can come in with them and sit and be comfortable while we go through the process. This may be the first time in treatment, maybe they've been in treatment before, so our intake coordinators answer a lot of questions. There have been times when I've come in, if I'm available, and we'll meet with the patient and greet them, welcome them to Sovereign. Our staff are very friendly here and very warm and welcoming. Sometimes our psychologist, Dr. Schoenbachler or Dr. Drury, if we're available, will come and meet with the patient. So this area of the building is dedicated to our medical team. Our medical team includes a psychiatrist, a nurse practitioner, we have nurses, and we have a urinalysis specialty person. So in this area here, we have exam rooms, and we also have a couple rooms set up in case a patient feels ill during the day, if they need to take a nap or just lay down if they don't feel well. So this is our urinalysis area. Patients submit regular urinalysis for testing as part of our program. Now that we've seen the medical area, we're going to go see our cognitive skills lab. So this is a very special part of our program. In our cognitive skills lab, our patients come in here several times a week. They're given an account. They log into Neurobics. And on Neurobics, they play brain games. The brain games allow them to start rebuilding some of their neural pathways. They think it's video games, and they really like it, but it also allows them to start rebuilding some of their cognitive skills. So this is our cognitive skills lab. Okay, so next we're going to go into another area that's a staff area, but I think you might be interested. So this is our staff training room. And in this room, our clinicians have regular trainings. But what's most important for the patient to know is this is where the weekly treatment team meetings are held. Every week, every Wednesday, for 2 hours, all of the clinical team comes together, the counselors, the case managers, our patient advocate, our psychologist, our psychiatrist comes in, our nurses, our nurse manager, and we staff patients. We discuss phases, passes, and anything that's important for patients. So now this is the patient area. In this area, this is where the patients spend most of their day while they're in their outpatient program. We have staff working. This is our case manager office, our clinical concierge, our marketing person. Our neurofeedback therapy happens in this room. It's very, very important to our program, our neurofeedback. We use what's called brain paint. It's very successful. This is one of our group rooms. We have 3 group rooms here that we provide treatment. This is for group therapy. We have process groups, educational groups, our trauma groups, substance abuse groups, mental health groups. We deal with grief. So in the group therapy, for example, in this room, we would have 1 clinician, maybe 2, and they will be teaching information as well as discussing. A process group means that the patients are interacting with the therapist and with each other. They're sharing information about themselves, and they're working through some of their problems and some of their issues. Okay, now I'm going to take you to another room where our patients have a lot of fun, so follow me. Now this is something the patients look forward to every week. We have art therapy. I have a licensed art therapist that comes in several times a week. She does art therapy here at our outpatient facility and also at our residential facility. So our patients do various projects. Art therapy is not just painting or coloring. There's always a meaning, there's always a goal, there's always something therapeutic that's done with the art. Our art therapist is part of our treatment team. Okay, now we're going to go down to one more group room. So this is our group room A. We teach classes in here. We teach information about cognitive behavioral therapy, DBT, which is dialectical behavioral therapy. As I mentioned earlier, we do trauma groups. We have groups on grief and loss, addiction groups, lots of different things. Stress management is very important, relapse prevention. So this is group room A. Now we're going to show you the day room. Follow me. So this is our patient day room. In between groups, our patients come through here, maybe have a snack, some water. We always want to have just a few minute break between the groups so they can sort of think about what they just learned before they go into the next groups. They also eat lunch here if they're with us all day for about 30 to 45 minutes. So now we've concluded our tour, our virtual tour of Chandler. I'd like to thank you again for joining me at Sovereign Health of Chandler. This is our outpatient facility at the Chandler Commons. If there's anything we can do to help, please contact us. Thank you.